I had a patient. I'll call him Robert to protect his privacy, 67 years old. Ate clean for over 20 years. Vegetables, lean protein, almost no processed food. Walked 3 miles a day, every single day. And one Tuesday morning, in his own kitchen, he had a massive heart attack. When I pulled up his cholesterol panel from 6 months earlier, it looked almost perfect. And that is exactly why I'm making this video today. This is not a rare story. In my years of practice, I have seen this exact scenario more times than I can count. Patients doing everything right by every guideline we've given them for decades, and still ending up in the ICU. Research published in the Journal of the American College of Cardiology found that nearly half of people who have a heart attack have cholesterol levels considered normal or even optimal at the time. Half. That statistic should genuinely alarm you, because it means the standard advice, eat clean, exercise, watch your cholesterol, while important, is missing something critical for a huge number of people. Let me be clear about something first. Diet matters enormously. Exercise matters enormously. If you are eating well and staying active, you are doing something genuinely protective, and I don't want you walking away from this video thinking none of that counts. It absolutely does. But diet only tells part of the story. There is a piece of this puzzle that almost nobody gets tested for, that has nothing to do with what you eat, and that could be quietly building plaque inside your arteries right now, even with a textbook perfect diet. Before I tell you what this is, I want to ask you something. Have you ever had a cholesterol test come back looking totally normal, but something still felt off? Or has a family member had a heart attack despite living a genuinely healthy lifestyle? Comment below and tell me. This might be more relevant to your family than you realize. Here's what's missing for so many of my patients. It's called lipoprotein(a). Doctors usually just say Lp(a). Think of it as a cousin of the LDL cholesterol you're already familiar with, except with one critical difference. It's almost entirely determined by your genes, inherited directly from your parents. Diet does not meaningfully change it. Exercise does not meaningfully change it. Even standard cholesterol medications like statins barely touch it. Here's a simple way to picture what it actually does. Imagine your arteries as a highway and cholesterol particles as cars driving along it. Most LDL particles are relatively harmless in small numbers. But Lp(a) particles are like cars that are extra sticky. They cling to the walls of that highway more easily, contributing directly to blockages, and they also interfere with your body's natural ability to break down blood clots. That combination, sticking to artery walls and interfering with clot breakdown, is exactly why elevated Lp(a) is linked not just to slow plaque buildup, but to sudden, unexpected events like the one Robert experienced. Research suggests as many as 1 in 5 people, roughly 20% of the population, has elevated Lp(a) without ever knowing it. That is not a rare genetic quirk. That is tens of millions of people walking around with a hidden risk factor no one has ever mentioned to them. The American Heart Association now recommends every adult get tested for it at least once in their lifetime, because unlike regular cholesterol, it typically doesn't change much once you're an adult, so one test can tell you your risk for the rest of your life. And yet, in my experience, the overwhelming majority of my patients have never had this test. It is not part of a routine annual physical. You often have to specifically ask for it by name. There's a second piece worth knowing about, and it works alongside this genetic factor to explain many of these unexpected heart attacks: chronic inflammation. Even with excellent cholesterol numbers, ongoing low-grade inflammation in the body can make existing plaque unstable, meaning it's more likely to rupture and cause a sudden blockage, which is what actually triggers a heart attack, rather than plaque simply building up slowly over decades. A landmark study known as the Jupiter trial found that patients with a marker called hs-CRP, a simple blood test that measures inflammation, had significantly elevated heart attack risk even when their cholesterol looked completely normal. Treating that inflammation directly reduced their risk substantially. This matters enormously for people over 60 specifically, because inflammation tends to rise naturally with age, a process researchers sometimes call inflammaging. So even someone who has eaten well their entire life may be dealing with more background inflammation now than they did 20 years ago, simply due to the aging process itself. This is why 2 people can have identical diets and identical cholesterol panels, and one has a heart attack while the other doesn't. The difference often comes down to these two hidden factors working quietly in the background: genetics through Lp(a) and inflammation through markers like CRP, neither of which shows up on a standard cholesterol test. I want to know, has your doctor ever mentioned Lp(a) or CRP testing to you before today? Be honest in the comments. I have a feeling most of you are going to say no, and that tells me exactly why this video needed to be made. So what do you actually do with this information? Here is exactly what I recommend to my own patients. First, ask your doctor for two specific blood tests at your next visit: an Lp(a) test and an hs-CRP test. Neither is typically included automatically in a standard panel. You often need to request them by name. Second, if you have a family history of heart attacks or strokes at a relatively young age, especially in a parent or sibling who otherwise seemed healthy, please don't dismiss that as bad luck. Genetics tied to Lp(a) can run strongly through families, and knowing your number could be one of the most important tests you get this year. Third, ask about a coronary calcium score, a simple CT scan that directly measures existing plaque buildup in your arteries. Research from the multi-ethnic study of atherosclerosis found this single test to be one of the most accurate predictors of future heart attack risk available, often catching problems that cholesterol panels completely miss. And finally, if your Lp(a) comes back elevated, I don't want you leaving this video feeling helpless. There is real, actionable ground here. Managing blood pressure aggressively matters more than ever, since consistently high blood pressure damages artery walls and compounds the risk. Not smoking matters more than ever, since smoking independently accelerates plaque buildup. And regular movement, adequate sleep, stress management, and diets rich in omega-3 fatty acids from foods like salmon and walnuts have all been shown in research to meaningfully lower inflammation, even if they don't touch Lp(a) directly. For many patients, doctors may also recommend a statin or other cholesterol-lowering medication, not because it lowers Lp(a) itself, but because it helps control the LDL cholesterol working alongside it. There are also newer medications, including PCSK9 inhibitors and Lp(a)-specific drugs currently in late-stage clinical trials, showing real promise for the future. This is an area of cardiology moving quickly right now. I want to leave you with this. Robert's story didn't have to end the way it did. If he had known his Lp(a) number, if his inflammation had been caught and managed years earlier, that Tuesday morning might have looked completely different. Every single day in my practice, I see the outcome of not knowing. I don't want that to be you or someone you love. You cannot control your genetics, but you can control whether you know about them. And that knowledge is exactly what most people are missing. If this video opened your eyes to something you didn't know before, please hit that thumbs up. It helps another family avoid the same shock Robert's family went through. Subscribe if you haven't already, because every week I break down what the research actually says about protecting your heart after 60. And please, leave a comment below. Are you going to ask your doctor about these tests at your next appointment? I read every single comment, and I will see you in the next video. Take care of that heart of yours. It's the only one you get.